COVID-19 pandemic has engulfed the whole world, it's really a time for a partnership for our children. A week ago, the Director General of the World Health Organization, WHO, said we must follow the evidence. There are no shortcuts. A week later, it still holds good. We must follow the evidence. You must have seen in the headlines of newspapers and television channels that children are now testing positive. Many parents are getting worried. Why are they worried? Because they want to know if their child has to be tested. When should they reach out to their physician, their pediatrician, or their healthcare provider? What is it that they can do to keep the mental and the physical well-being of their family going? Well, the good news is doctors and public health experts are also thinking on the same lines. We've come up with protocols and we've come up with ways to support our parents and our children. Well, before I go into the details, let's look at the dashboard. As of today, the 6th of April, 1.2 million people have tested positive in over 200 countries. We know there are close to 70,000 deaths, but we know this curve is also flattening in some parts of the world. We know there is no cure yet, and we also hear more and more countries are deploying rapid diagnostic tests. But the important takeaway is this, that we know that it spreads through droplet infections, both by people who are infected and are symptomatic, as well as carriers who are asymptomatic. So the takeaway message, look out. The virus is everywhere. We know that India went into a lockdown at the stroke of the midnight hour on 25th March. States like Tamil Nadu had closed schools almost 10 days ago. The principle behind this lockdown is containment, so that the virus doesn't move with people and materials, so that we can slow the progression of the pandemic. And I think we have done well. But this is not enough. Testing has to go on if we need to know the exact situation. We have started testing and the numbers are increasing. Only then will we know what is the full scenario. But in the meanwhile, here are some practical instructions. Listen in, listen carefully. Make sure that you maintain physical distancing. Make sure you wash your hands, it's extremely valuable. Please keep your home clean, it helps a lot. Make sure that you think about the mental and physical well-being of your family. If your child wants to do something, be a little flexible. Ask the child what they would like to do. Use this time to build relationships. And remember, if your child does run a fever and it is persistent, there is cough, you can reach out to your physician, your pediatrician, or the healthcare facility nearby. But in the midst of all of this, I also want to tell you and remind you of something. Besides taking care of your own children, if there's a vulnerable child around whose life is dictated by the daily wages of their parents, reach out. Your child will learn from you. If there is something that you can spare for a family that is in need, do that. Your children will see how you actively care for one another. All of this contributes to the social, mental, and the physical dimension of health. But we know that this pandemic will go on for a while. So I cannot reiterate more how important it is to believe in the measures that the scientific team has given to us. It's so important to sustain it, and it is so important to adhere to it. As the number of days in the lockdown go up, adherence could be a challenge. So remind yourself what you have to do, remind your family and remind your neighbors as to what they can do. But let me tell you one more thing. We have to be patient as a nation. We have to be patient as a community, and we have to find time for one another. Tomorrow is World Health Day, April 7th, and I can't reiterate more how health is such an important gift you can give to your child. A healthy child is a happy child. A healthy child is a productive citizen of the nation tomorrow. A healthy child is a meaningful member of the society. So let's do our role, let's do our bit, let's take care of our children during this unprecedented pandemic.